Nowadays, people cannot make the difference between normal hypertension and pulmonary hypertension. Well, hypertension is the pressure inside your arteries in your body, which when increased beyond a certain normal limit is known as hypertension. This normal recording of blood pressure in your blood vessels is done by a sphygmomanometer, which is now internationally taken as 120 by 80, 120 systolic and 80 diastolic. If you differentiate this between what is actually pulmonary hypertension, pulmonary artery is the blood vessel which carries blood from the right side of your heart to your lungs, and the pulmonary vein brings the same blood oxygenated back into the heart. When the pressure inside these blood vessels increases beyond normalcy, being 25 millimeter of mercury, it's known as pulmonary hypertension.
Pulmonary arterial hypertension is seen in all age groups, in all gender, and across all racial groups. It is a very common entity which we encounter on a daily basis. The pulmonary arterial hypertension causes a lot of very common symptoms like breathlessness, edema of feet, chest pain, palpitation, giddiness. These are very common symptoms, but if it is not diagnosed, then it can cause catastrophic results. Usually the patients need to go to the doctor early in these symptoms just to check that they have pulmonary arterial hypertension or not. And the causes are many. It can be clots in the lungs, chronic smoking, simple blood pressure, or long-standing diabetes, cirrhosis of liver, congenital heart defects like holes in the heart which are small and not picked up early in life, and so on and so forth.
So when treating somebody with pulmonary hypertension, the first thing to do is to make sure the diagnosis is accurate. The diagnosis of pulmonary hypertension is sometimes not easy. It may involve getting tests done which include things like an echocardiogram as well as a test which includes a right heart catheterization. Once we know for sure that the pressure is high, we have to institute measures to try to lower it. Now the pressure itself doesn't really mean much if it is taken without consideration of the patient's symptoms and what is the cause of the problem. We can sometimes do something called a very simple test called a 6-minute walk test, where the patient actually walks for 6 minutes. We check his oxygen level. So in pulmonary hypertension, the oxygen level can go down. One of the most important treatments is to give oxygen therapy. And the oxygen can be given with a tank in the house. It can be given in the hospital. In fact, sometimes people even use it when they're traveling. There are several medicines which help decrease the pressure in the pulmonary arteries. And the way that happens is that they relax the tubes. In summary, pulmonary hypertension management involves some very simple therapies, but also involves some complex measurements of the pulmonary pressure and treatment of this with chemicals which relax the pulmonary tubes. There are some surgical options also, and along with transplantation, there is something called atrial septostomy, which is a very complex procedure, but actually allows the blood from the right side of the heart to get to the left side. Pulmonary rehabilitation has taken on a huge role in managing patients with pulmonary hypertension, and oftentimes you need a group of doctors to manage you. These might involve a rheumatologist, a pulmonologist, a cardiologist, and your general medicine doctor to help you manage pulmonary hypertension.